First, you get a small spot on your tooth, and then it leads to tooth loss and spending hundreds of thousands on an implant. Caries progresses in your tooth even while you sleep, eat, or listen to me. And with each passing day, the situation becomes irreversibly worse. That's why it's important to know the stages of caries. This will save you money and your teeth will hurt less. Now I'll briefly explain the stages of caries when you'll have to remove a tooth and at which stage you won't even need to drill holes. According to the World Health Organization, caries is the second most common disease in the world. Caries that appears on the teeth leads to pulpitis and periodontitis. That's when you have to remove the tooth nerve or when the inflammation reaches the very root of the tooth. The main reason why teeth start to hurt and why it becomes more difficult to treat them is not seeing a dentist in time. What happens if you don't treat caries? Any carious process will always progress without treatment. That is, it will only get bigger or go deeper. Caries begins at the spot stage. When you see just a small spot on your enamel that differs in color, that's not yet caries, but it's the very beginning of it. In other words, this is the initial, let's call it caries, but it's not yet damage to the enamel. The doctor can treat this type of caries without any intervention or drilling, simply by applying special compounds that the enamel will absorb, and in this way you will cure your caries at the spot stage. If it is not treated, it progresses. This then develops into moderate caries and then deep caries. That is, our enamel is not the main part of the tooth. Beneath the enamel is the structural part, or the foundation of the tooth, which is dentin. That's what our tooth is made of. And when caries progresses, it affects both the enamel and directly the dentin itself. And behind the dentin, as they say, it's not far at all to the heart of the tooth pulp. That is, the pulp contains all the nerve and blood vessel pathways that nourish our tooth. So if the pulp is affected, as they say, and we treat it, most often that means the tooth is already dead. Yes, it will still function, but in most cases, it's already a dead tooth. In addition to the pulp, if we still do nothing and don't treat it, the roots of the tooth become involved. And what's even worse, besides the roots, we also affect those areas, the so-called bone that surround our tooth or surround the roots of our tooth. This is exactly what makes it dangerous. If we don't treat the tooth, we can actually develop a serious condition like periodontitis or osteitis, which is inflammation of the bone. And this can lead not only to abscesses and phlegmon. Most often patients come in either with early stage cavities or already with pulpitis. This is because, firstly, with early stage cavities, the patient no longer just has a spot, but let's say a small dark hole in the tooth. And at this point, it bothers them mainly for aesthetic reasons, right? And pulpitis, because by then it already hurts. So at some intermediate stage, it's probably quite difficult to catch, or unfortunately, the patient simply doesn't seek help. The earlier you visit the dentist, the more you save not just money, but also time, nerves, and most importantly, your health. Because sometimes it's no longer possible to save the tooth, and this leads to extraction, implantation, or the placement of bridges, but that's a completely different story. If you want to learn how to whiten your teeth at home, give us a like, take care of your teeth, and follow our channel. Subscribe. See you next time. Take care of yourself and your loved ones.